My name is Kemwali Kugpa. I'm the owner and director of Care's Homecare. We provide care to hundreds of people in Bristol and surrounds. The reason why I have enlisted the help of a Dr. Obi Ogugu to help us with this video is we've had some anxiety from some of our care workers and their family members, particularly people from the immigrant and black ethnic and minority group who have expressed some anxiety and concern on why they are resistant to take up the offer of the vaccine. There is an overrepresentation of black and ethnic people that have suffered extreme effects of COVID. When you look at the vaccine take-up, it's not representative of that number because very few people are taking up the offer from those groups. By all means, not everybody. I personally have had the vaccine. Mr. Obi has been part of the trial. In fact, he's had both vaccines. So we're urging everybody to give up the fake news. You've fought a good fight. You've come this far. Just one final push. Take that vaccine up and help us get out of this lockdown.
Well, the vaccine was created, I would say, obviously because there is a pandemic, a COVID-19 pandemic, which everyone's aware of. It's claimed many lives across the world and led to a huge change in the way society runs because we are taking all the measures that we possibly can to try to stamp it out as far as that is possible. So that's why the vaccine has been created. As to whether the government is trying to, or anybody is trying to collect anyone's DNA, that is certainly not the case. It is a vaccine no different from any other vaccines that have been given to people across the world for many years. It's quite safe, possibly safer than many other vaccines that have been designed in the past. I would strongly encourage people to have it. Yes, I've had the Oxford vaccine as part of the trial, the first dose in June and the second in August. As part of work, I then had my first dose of the Pfizer vaccine earlier on this month, and I'm due to have my second dose in March. Well, there are various reasons for having the vaccine. The first is that it protects you yourself. While the risk of dying may be quite low for younger people, there is still a risk. But it's not just a risk of dying, there's also a risk of becoming ill. And obviously becoming ill affects your ability, even if you're ill for a short period, you do have to have isolation for a time, and that impacts on your life and work. The other reason is a proportion of people, even if they don't die from COVID, may end up ill enough to need to be admitted to hospital, and that's obviously something anybody would want to avoid. The final thing to say is even if you don't die, if you get really sick from COVID, you could be in hospital for months. Some people are on life support. They don't die, but they end up spending many months recovering from all of that. Apart from personal risks, ultimately, if lots and lots of people have the vaccine, then we cut down transmission within the community, and that protects people who are a lot more vulnerable than we ourselves might be. So the risk of dying from COVID when you're above 80 is higher than 10%. And so it makes a big difference to those people if we can't give it to them because we've been vaccinated. We are asking everyone to continue taking the standard measures that everyone is now hopefully familiar with, distancing, wearing masks, hygiene, etc. I would say there are three main reasons. The first is that a lot of money has been thrown at the problem. And so that has not been an obstacle in any way. The second is that the COVID vaccine design did not start from scratch. There has been a lot of vaccine design that has gone on for decades, and we already had a partially designed vaccine for the, I guess you could say, precursor of COVID, which is the SARS-CoV-1 of about, 10 years ago. The third reason is that a lot of all the different steps that it takes to develop a vaccine, rather than being done one after the other, were done simultaneously. And that's allowed great speed. So it isn't that any shortcuts have been taken, it's just that a lot of things have happened at the same time. So currently in the UK, there are 2 vaccines available, and they are the Pfizer vaccine and the Oxford vaccine, which is also called the AstraZeneca vaccine. The short answer is no. Some people have flu-like symptoms such as headaches, fatigue, fevers that lasts perhaps up to 24, maybe 48 hours after having the vaccination. Some have nothing at all. None of that tells you whether the vaccine has worked or not. It's just different from one person to the next. As an example, I've never had any such reaction to any of these vaccines, and I know that my antibody levels are quite good. The reason we're confident about vaccine safety is that the design of all of the major vaccine trials has been geared to make sure they answer questions about safety. And so extensive data has been collected from all trial subjects about any potential side effects. And that data is widely available, and no major side effects really have been picked up in certainly from the trials of the available vaccines. In addition, the vaccines are now being rolled out across the world, and so millions of people have had them. I would say if there were significant side effects, we would have heard about them by now, but there aren't any. We're not getting any reports of major side effects, but we are watching, the relevant authorities are watching very carefully. Okay. Many of the trials have cut across multiple people from all sorts of backgrounds, ages, and different ethnic origins, particularly the Pfizer and Moderna vaccines in America. There hasn't been any difference in effectiveness based on ethnicity at all. So as far as we can tell, it works the same regardless of what your ethnic background is. As to the reason why Black and ethnic minority people seem to have more severe COVID or seem to get COVID a little bit more than others, that has been established from data gathered. There is no, as far as I know, we haven't found any inherent reason, there's no genetic reason for it. It seems more likely it is because there are certain medical conditions that predispose you to getting COVID or getting a more severe version of COVID. And that's what's actually causing that effect. So conditions like high blood pressure, diabetes, and obesity are probably a bit more common in Black and ethnic minority people. And we think that's probably the reason, some of the reason for this. Also, to an extent, it's to do with occupational exposure. So Black and ethnic minority people seem to work, a higher proportion of them work in occupations where they are more likely to be coming in contact with people, such as healthcare, social care, jobs that are public facing, such as working in bars, restaurants, bus driving taxis, etc. And so it means, therefore, you would expect to see a higher proportion of such people having COVID. Yes, the vaccines don't contain any animal products, so they're perfectly fine for vegans and vegetarians. There are no pork-based products for those who are concerned about that sort of thing. They, in terms of what's in them, I don't want to get too technical, but they are standard. The Pfizer and Moderna vaccines are RNA vaccines. They have the standard things you'd find in many, many medicines that help to preserve what's in them and things to dissolve the active constituents. But there isn't anything of interest really as far as those concerns go. And the information about what's in vaccines is widely available on the internet. Yes, I believe the Catholic Church have actually sanctioned having the vaccine. There's nothing, there's no concern as far as that's concerned. You're right, I have no direct knowledge about that sort of thing, but as far as I'm aware, I believe the imams in this country have actually taken it upon themselves to say to Muslims that there is no danger in having the vaccine. Apparently, it is deemed halal, and I believe there have been imams publishing videos of themselves receiving the vaccine in order to encourage people that to feel confident about having them. Okay. There is no data from any trials that suggests there is an impact on fertility. And there is no reason, when you look at what's in them, the chemical constituents of the vaccines, there's no reason to think they should be dangerous for pregnant women or women trying to get pregnant. In fact, recently I've had colleagues who have just become pregnant, and they've been advised to have the vaccine because the feeling is that it is probably more dangerous for you to have COVID while pregnant if you get severe illness. If you have the mild version of COVID, you'll probably be fine. But if you had severe COVID, your pregnancy is probably more at risk from that than we imagine it could ever be from a vaccine. In people who have severe allergic reactions to other things, they are being advised to be careful about the vaccines. It is possible that those people might also have a reaction to the COVID vaccine, but that refers to people who tend to have severe allergic reactions, which is a very tiny proportion of the population. As long as they're not severe allergies, they should be fine. If they are severe allergies, they should discuss that with their doctor and they'll be given appropriate advice. Well, I'm not sure I can completely answer that question, but all I would say is within the UK, you should only be getting an invitation to have the vaccine from the NHS. Remember that there should be no reason why anyone should be asking you for money of any sort. So a red flag should be anyone asking for bank details. It's easy enough to, if you get an invitation from your doctor, you can always, if you get a written invitation and you're not quite sure about it, you phone your doctor to check to see what the true story is.
Thank you very much for watching this video. I hope you have found it helpful. And if you are able to give us any more support to spread the word, please get in touch. And if you need any guidance or signposting or direction for further information, please get in touch or go to the NHS website.